When I became pregnant, then you immediately notice a shift in the way people treat you.
Unconsciously, if you see a female surgeon, then you realize that she needs to prove herself before you can trust her.
His friend said if you put toothpaste in your eye, that sort of it will cool it down.
So this happens very often with me in burns.
They put toothpaste.
They put toothpaste.
So and that has happened.
And ultimately, you're playing with somebody's vision.
Yeah. So even 1 millimeter here and there during surgery, you'll suffer. It will make you realize कि ये incision तुमने गलत लिया है.
So welcome back to the show. This is Beyond the Scrubs with Dr. Swaminathan. Joining me today is my very close friend and highly accomplished ophthalmologist, Dr. Nikhila Sathe, who's working in Pune. She has done her MS in ophthalmology and then she's pursued her fellowship in glaucoma treatment. So she will be telling you all about what glaucoma is. But before that, let's go on to a few questions. So, Dr. Nikhila, what drew you to ophthalmology as a specialty?
So when we're doing MBBS, we go through all the subjects, and I knew for sure that I don't want to do anything which is medicine related. Okay. I wanted to do a surgical field, but I also didn't want to do all the blood and the gore and all that.
So no hardcore surgery.
Yeah, so that left me with a few choices, one of which was ophthalmology, and I was lucky enough to get it.
When we were in MBBS, they used to call it the road to success. You know road to success?
No.
Radiology, ophthalmology, anesthesia, dermatology. So ye charo kar lo to you will be successful. As you can very well see, she is quite successful.
That makes a lot of sense.
Yeah. So if not medicine, what do you think you would have done?
So I didn't think that I would get into medicine because all India PG or whatever, all India undergraduate exam.
I don't think anybody who writes the exam thinks that they are going to get in.
So I had a backup. I had taken admission in biotechnology.
Hey, me too.
Really?
Yeah. I had taken a 6 years integrated course of B.Tech and M.Tech in Pune University. I had joined.
Oh, yeah, me too.
Yeah, so I joined and then I realized I can't do this. Yeah,
My professor on the first day said, "You're not going to remain here." So then I was like, okay, at least he's confident that I'm going to get in.
Where was this? In Pune or?
No, in Goa.
In Goa, okay. Oh yeah, you're from Goa. So tell us about medical college in Goa. How was that?
Just like medical college everywhere
I highly doubt it.
Only plus point was if you bunked, you got to go to the beach.
Yeah, we got to go to Katraj Highway, and Katraj Dairy and have some flavored milk. That's about it. You did your MBBS there?
Yes, I did my MBBS there and then subsequently PG in Miraj. And then I moved to Pune after I got married.
You still want to go back to Goa?
Always.
Is it to practice ophthalmology or for other things?
Both, I think. If I get to practice ophthalmology while living there, that would be a cherry on the cake, sort of.
I can imagine. So tell us about your practice. Like, what does a typical day look like? Like, if somebody who is watching who wants to do ophthalmology, what does a day of an ophthalmologist look like? What do you do in the morning? Like, as a plastic surgeon, I'll tell you what I do. Yeah. I will schedule all my surgeries in the morning. I don't like to operate in the afternoon. I like to do surgery, then OPD, clinic, and then come back home.
Oh yeah, same. So I also like to do surgery right in the morning when you're fresh and you don't have any distractions. You just go finish it off and then go ahead with your day. But sometimes my day doesn't allow it because I have a kid, so I have to send her to school and all that. So then I end up doing surgeries in the afternoon.
That's something really we wanted to talk about is how women in medicine and especially in a surgical branch, how much more challenging it is for them. So did you ever think that, or did you ever feel that because you had to pursue your personal life and have a family, you had to take a step back in your career? It's obvious, but at what point do you think that happened for the first time?
When I became pregnant, then you immediately notice a shift in the way people treat you. Automatically they think that okay, now that she's pregnant, she's not going to be able to work, she's not going to be able to take major clinical decisions, which is not the case. My brain is working just fine. I did take a break after I delivered and
obviously
postpartum.
While the baby is young.
While the baby is small. but then because my family was so supportive, I was able to get back, and I really have a very, very supportive family, and that's what I think, when they say it takes a village to raise a child, that's true, and I wouldn't be able to get back to ophthalmology if it wasn't for them.
I think as a man in surgery, we do hold, it's not like a conscious bias, but you will always have an unconscious bias because, generally surgical branches are
Male dominated.
Male dominated, and the glamour around it is, eye of an eagle and lion's heart, and, never a lioness's heart. So you always do carry a bias unconsciously. Ki, if you see a female surgeon, then you realize that she needs to prove herself before you can trust her. Whereas if there is a male surgeon,
you automatically
trust them till they screw up and you realize, okay, this guy's no good. I think that's very unfair, which we unconsciously have a bias towards women.
But there's a study that shows that women surgeons are more empathetic, and therefore they have a better relationship
I've read that study,
with their patients.
I have read that study. Yes, they do have more empathy, and that's true. But then there are a lot of biases in that study.
Okay. Let's agree to disagree.
We'll agree to agree partly. I don't agree to disagree. So, as an ophthalmologist operating almost every day, what do you feel? Which kind of cases challenge you? Like, which are your routine cases that you operate, and which are like your challenging cases?
So routinely I do cataract surgeries or some small lid surgeries here and there, a pterygium, which is some conjunctival surgeries. But the glaucoma surgeries are always challenging because especially when there's advanced glaucoma and you have a very small sort of range of when we operate intraocularly, there's a pressure fluctuation, and even a small pressure fluctuation can affect that patient's vision very drastically. So I feel like these advanced glaucoma cases are always challenging, even post-operatively, to manage.
I think people don't really understand what glaucoma is. So if you can give them like a short thing on what glaucoma is.
So glaucoma
for somebody who has no idea what it is.
So just like we have blood pressure, we also have eye pressure, which is normal is less than 20 millimeters of mercury. When the eye pressure raises above 20, it starts affecting the nerve which connects the eye to the brain, and slowly this nerve sort of gets damaged, and the person does not realize that they have glaucoma, and until it is like 80-90% damage, then they realize, oh, I can't really see very well from this eye. So since it's a silent thief of sight, we are always very, very cautious and little bit I would say we prescribe tests.
You want to screen for it rather. You want to screen a normal person for ocular pressure.
Sometimes unnecessarily, I would say, but I'm always honest with my patients that, it's always better to check and be sure that you don't have it rather than miss.
So the way they check is mostly an eye puff, I suppose. Puff tonometry.
And a perimetry test.
So many of you would have sat and they'll blow a shot of air in your eye. Doesn't feel very nice, but that's what it is. So tell us a misconception about eye health which you must have heard from a patient which really stayed with you and you thought, wow, like people believe this too. Now I've heard it all.
So it was Diwali time, and this guy was bursting some firecrackers, and some of it flew in his eye, and then his friend, his friend said, if you put toothpaste in your eye, that sort of it'll cool it down. And
so this happens very often with me in burns.
They put toothpaste. So many people put ink, they'll put toothpaste, and then it takes so long to remove it in the OT because every time you're washing it, it just makes more foam. Exactly.
It just pepsodents the whole OT, and then you're like, "Kya chal raha hai?" What do you feel was the toughest phase of your training as an ophthalmologist? Was it MBBS, MS, or or glaucoma? Because I'm telling you, because as a plastic surgeon, so as you grow, each phase feels simpler than the next. Because you have gone through it now, it's in hindsight. But when you complete everything and you look back, I would say my MS training was the hardest, more than my MCH. Even though MCH, I was a single resident for 1.5 years and on call every night for 1.5 years.
Oh my God.
And in a government hospital dealing with hand injuries. But still, I would say MS was my toughest time because
Yeah, you have to deal with everything.
yeah, and you're learning something so new.
Yeah.
Which,
For sure.
as an MBBS, I'm
You
sure
had
you
no
would have
idea.
faced the same thing.
Yeah.
As an intern, you're the king of the jungle.
Correct.
You know, because you are the senior most and you
Yeah.
know all the 4 years.
Yeah.
They know you as a senior.
Yeah.
But then when you enter the hospital setup, you realize you are the lowest. You're not even the lowest rung. You are the ground on which the ladder is standing. So tell us about your ophthal training.
The
Like,
food
what was
pyramid,
new?
like you're the
You're the dust on which the pyramid is standing.
Yeah, so for me as well, like during my ophthalmology training, especially I think because ophthalmology is a language in itself.
Yeah.
You have not heard any of those terms during your MBBS, and it starts off with, this patient has ankyloblepharon, and you're like, that, what?
Yeah, I just know bleph.
Yeah, is it where the eyelid sticks to this or what? What is it? So it starts off with that, and then there's retinoscopy, and then there's so we used to have camp patients, there'd be 50 patients every day.
Wow.
Every day you have to work up 50 patients and operate for cataract, operate the 50 patients the next day and discharge those 50 patients. Wow. And then again the cycle starts. So every day it would be just this. And after some time it becomes like clockwork, but in the beginning you really struggle. You really struggle to correlate the vision with the cataract, and then why is this patient, you have to pick up every small thing, otherwise the patient will get operated and then they'll not improve, and then that means you've missed something pre-op. And right eye, left eye is also a big deal with us.
That's so scary. Because it happens in movies a lot, they operated on my right brain and my left brain. That stuff doesn't happen. But right eye, left eye definitely can happen. It's very easy. And for you guys, you just heard us say ankyloblepharon. We use a lot of Latin terms in medicine and surgery.
Yeah.
It seems as though we are being elitist by, not by using terms which the public won't understand, but it's not true. The reason is that when you learn these terms, when somebody says ankyloblepharon, the person who knows it knows exactly what they're talking about. Like, you don't need to use any words to explain what it is.
Exactly.
So that's the reason why we use these terms. It's not like we're trying to act smart with you guys. Okay. So tell me about... Okay, let's go to technology. I know Ophthal is a branch which is, very technology dependent.
Very.
When did you realize that you are so dependent on machines?
When I took ophthalmology, I didn't realize that it would be like this, because if you think about it, around 20-30 years ago, ophthalmology was just like that mirror retinoscope and maybe a slit lamp if you were very fancy, or they would just use loupes and operate in camp settings. But now it has gone to, intraocular lenses, and for everything you have a machine that reads your number, you have a machine that diagnoses your retinal error, you have a machine that diagnoses your cornea. Everything is machine dependent, and halfway through my residency I realized that this is a very, very expensive branch.
Yeah, exactly. So much money you need to put in.
So,
and technology changes very fast.
Very fast. You have to keep up, because then the next this machine which you have is going to go out of
it's going to be outdated.
Outdated, sorry. It's going to get outdated in 5 years.
Yeah. And how much do you spend for an average, I don't even know what machine, like a laser machine?
So an average OPD setup would be around 15-20 lakhs now.
Wow.
And OT almost the same, little more depending on which phaco machine, there's no upper limit.
There's no upper limit, obviously.
You can buy as fancy a machine as you want. So for a person who's like a first generation ophthalmologist,
is that you?
Yeah. So there's nobody in my family is a doctor.
Yeah.
So it's a quite an investment.
You have to invest a lot.
Yeah.
I mean, it's luckily it's not so in plastic. So every time I'll go to hospitals and they'll show me that this robot and that robot. And I tell them, we don't have robot, we just have dobot. Dobot in Marathi is 2 fingers. So plastic is not a very technology dependent branch, so I'm lucky that way.
But you also have those loops, fancy
So
lights.
it's not so expensive.
Yeah.
And of course, the microscopes and things that you need for super micro is something which is like 80 lakhs and 90 lakhs, which you can't you can't buy. So you leave it on the institute to buy. So tell me about what qualities make a great ophthalmologist.
So
You can just tell us about your qualities, because I know you are a great ophthalmologist.
Oh my god, this is like the first compliment
Brownie points.
I have gotten from my friend. Ophthalmology is a microsurgery, so you need to have very, very stable hands while operating under a microscope. Otherwise, you'll realize that I am messing up. During your training only, you'll realize that this is not my cup of tea.
But is there a way to practice?
We practice on goat's eyes.
Yeah, I did that.
You practiced on goat's eyes?
In my third year, MBBS.
Why?
So, because I wasn't understanding the anatomy of the eyeball.
Okay.
So I went to the mutton shop and I bought goat's eyes. If you guys visit my Facebook, there is an album called Home Goat Eye Dissection.
Oh my god.
So I dissected out all the parts, and that's when I realized what is retina, what is choroidal epithelium, that blue color, iris, uska color kaisa hai, the cornea, the sclera. I actually understood that because I was one of those kids who would read the foreign textbook. So I used to read Parsons, which assumed that you know basic anatomy. And I didn't. So a similar ankyloblepharon situation happened. I didn't know what he's talking about. So then I went and got a goat's eye and I practiced. I really didn't know. I didn't know that that's what you guys do.
Even when to get a feel of the tissue, we pin it and we look at it under a microscope and then we practice making incisions and everything in the goat's eye. And
so steady hands. What else?
Very, very. You need to be you need to give a lot of attention to detail. A plus B has to equal C, otherwise if it doesn't add up, something is wrong. Because the eye is such a small structure, you can easily miss findings. So and that has happened obviously.
And ultimately you're playing with somebody's vision, no? So
even 1 millimeter here and there during surgery, you'll suffer, it will make you realize कि ये incision तुमने गलत लिया है.
With every movement.
And it has implications on people's lives and their vision for the rest of their lives. So, there's a lot, big responsibility.
And I guess you need to have a very calm demeanor in your OP. Partly because... I mean, if I were to visit an ophthalmologist and I need something done to my eye, you need to be so comfortable with that person. Like my wife doesn't let me put eye drops for her.
Oh my god, same with my husband.
She will run.
I think a pair of such people only get married.
So literally she will not allow me to put eye drops. And I can imagine इसका cataract जब होने वाला है, कौन करेगा इसको?
Oh my god. My mother-in-law, who is a gynecologist, has told me expressly that please put me under general anesthesia when you're operating my cataract. I cannot keep my eyes open.
Scary. That's good. Suppose one of our younger viewers is considering taking up ophthalmology. What advice would you give them? Yes or no? Let's start with yes.
Because it's a very,
it's the road to success, why not?
Balanced. You don't have a lot of emergencies. You can look after your house, your family, and have a successful career at the same time. If you have a lot of money, that makes a big difference.
I saw one meme that day, how to have $1 million when you are 35. So they say step 1, step 2, step 3, step 4 something, and then step 5 they say ask your dad for $1 million.
I swear, your generational wealth is the way to go.
It's the way to go. No, but seriously, Opthal is a great branch. I work very closely. I have to work very closely with them because we deal with orbital fractures and things like that in trauma. Optic nerve decompression and things like that. So we need more Opthal.
Very rewarding. I like my branch a lot.
Now that you have your own clinic and you have moved to a bigger setup, what advice do you give someone who's planning to start their own clinic?
One step at a time. It's going to feel very overwhelming in the beginning when you need to, invest so much. At one point, there will be negative balance in your savings account.
Many points.
At many points, But then you build from that, and slowly you get out of it, and then you, at some point, you will break even, and then you'll be like, oh, it's not so bad.
Yeah.
But then, you'll remember that it was bad at one point. But eventually it all works out. So
tell me about some really challenging case you did and you were like really happy with the outcome.
Oh, so there was this patient who came in with bilateral advanced cataract, what we call mature cataracts. She came in with her two daughters. Each of them was holding one arm because she couldn't see anything, including the food on her plate. So This was when she couldn't even go to the toilet by herself. And the reason was that she was afraid of coming to the hospital and afraid of getting surgery done. So it took a lot of convincing, a lot of counseling. Finally, she agreed to get the first eye operated.
This was one of your earlier cases?
Yeah.
Early on,
as in maybe 2-3 years into practice. And once she got her first eye operated, she was so happy. She was so elated. She said, for the first time I can see my grandchildren's faces, which she couldn't see earlier.
I mean, people wait that long in this day and age is surprising.
But just that fear which she had of, doctors and anesthesia and pain and whatever. I think a lot of people have
I've seen many people behave that way with total knee replacement.
Oh, yeah.
Like they will limp and suffer the pain, do some tail malish all day, but then they will not get their knee replaced. And because somebody somewhere would have told them,
some bad experience.
मेरे पहचान का किसी का हुआ था और उसका घुटना ही अभी हिलता नहीं है. I tell them, uncle, आपका अभी भी नहीं हिलता है.
Exactly.
Literally nothing to lose.
I tell them it's like किसी और को diabetes हो गया और आपने मीठा खाना छोड़ दिया.
Yeah, exactly.
It doesn't make any sense.
Yeah, it makes no sense. Hey, that's a good line. I'm going to use that. I'm going to hijack that line.
Yeah, of course.
In ophthalmology especially, I know it's a very crowded space. Do you feel ethics are going for a toss?
I feel like in every branch.
In medicine in general,
in every branch there is, and it's not a lot of people, okay, but there are very few, I would say chosen chosen few,
ones,
who will practice a little bit unethically, but then that gives a bad name to all the rest of us. And there are many patients who will come in with this distrust only. कि doctor इधर बैठा ही है अपने को to fleece us. Which is not the case. Most of the time, doctors are there to help you and to make your life easier. This is what I tell patients a lot of the time. I am not here to harm you or to make your life worse. We are only here to help you. And they say, like, there's a quote that says, medicine is the only branch which works day and night to remove the cause of it even being there. I don't know, like the root cause is people falling sick, and that's what we want to remove.
Yeah, we want to remove our own existence.
Yeah.
I know what that means. It's similar in plastic as well, because many times we will have patients who genuinely need surgery, and then they'll walk in the door and the moment you see them, they don't trust you. And part of why OPD work is exhausting is because you have to still try to convince them.
Prove.
Any other profession, you can very well say that करना है तो करो, नहीं तो जाओ. लेना है तो लो, नहीं तो जाओ. In our field, you can't, because there is a last bit of humanity left, which shows you that I can set your problems right. Just do what I'm saying. But you can't tell the patient.
You can't say that.
You have to allow them to come to that conclusion themselves. That's exhausting. So I guess that's where many times ethics go for a toss, and also there are a lot of grey areas in surgical branches. Where karo to bhi it will improve, na karo to bhi it will improve. So I feel many surgeons fall prey to that, where they will.
Plus you can have a different professional opinion than other people, and then if the patient, many times they misinterpret it.
They misinterpret it.
So that's ethics, something I've struggled with as well.
So let's go beyond work. What part of, I mean, I know work is always fulfilling. What do you do once you're done with work to relax and recharge?
So I don't know if you do this. I listen to a lot of music during surgery.
OT. Yeah, I do.
So after I'm done, after us, I have a small little keyboard, like an electronic keyboard.
Oh, you play the keyboard?
Yeah. So I play some of the songs. I'm not very good, but I do it to just, for
As
myself.
long as you are listening, I think you don't need to be good. You don't need to be very good.
Me and my daughter. So, don't say poor thing. So, I play the piano and I run.
Yeah.
I feel like that also helps me a lot to sort of bhadas nikalne mein.
Yeah. Any
I don't know
physical
what it is.
activity.
Yeah. So I run a lot, and I go to the gym sometimes because
I know you read a lot.
Oh yes, I also read a lot.
I've-
Reading is like my favorite thing to do.
I've been trying to get back to reading, but then somehow I don't. I mean, I have this problem where
Attention deficit.
no attention deficit. My attention is fine. I mean to say, I suffer from always on call syndrome,
Oh yeah.
where you don't allow yourself to ever say no to picking up a phone call.
Yes, I know a lot of surgeons. I know a lot of
I don't know why we do
doctors
that.
who do that. Yeah.
I don't know why we do that. Because I feel you don't want to ever be unavailable
Yeah.
or labeled as someone who's not available.
Yeah.
I think that is a problem with us.
The only time I think it happens is if you go international and then your phone
Yeah,
is not reachable.
yeah.
That's the only time.
Even domestic, yeah, you're right. Even domestic, even this time international, I was in Korea last week. And I still kept follow-up of my patients' flaps and grafts कि मुझे photo भेजो. Because who else will see?
Yeah.
You know, that's the problem. So I guess I need to work on that.
No, but I totally get it. I mean, that responsibility doesn't leave you even
I'm
after
sure
you
Swaraj
exit
must be like
it.
that.
Yeah. After you exit the hospital.
You never really exit the hospital.
Yeah, it's
Your
still-
body exits. Yeah. But
Always
that's
praying.
something which I've seen other professions are very good at managing.
Yeah.
Seen some family members. Friday evening, abhi jo bhi hai, Monday ko dekhenge.
Yeah.
We don't have that luxury.
No, we don't have that.
But I guess we have to make a choice towards that. Wow, Nikhila, I'm learning something from you.
Are you surprised?
I am very surprised. And the next question on surprise is, what is something about you that will surprise your patients?
Something about me that will surprise my patient.
Something that
Something that has consistently surprised patients is how old I am.
I know you're 52. Give us one piece of daily eye care for all our listeners.
I think because
Many pieces. I think one piece is not there.
screen time has increased so much.
Yeah.
We're always in front of a screen. It's not your phone, your computer, your tablet, your
So ironic, now people are watching this on the screen.
Yeah, so take frequent breaks from your screen. Don't give screen to your kids. There should be zero screen
Till
time
what age?
for any kid less than 3 years.
3 years?
Zero screen time.
My son is 2 years and few months too early then.
Yeah, so don't give screens to your kids. Regulate their screen time. In the end, you are responsible. I have patients who come to me and say, "Ye sunta nahi hai." Sorry, but he's your kid.
Yeah.
He has no choice. He has to listen.
He has to listen. Yeah. What about
Don't-
eye drops and things which people put in their eyes nowadays? Now it's become a fashion.
Oh yeah, eye tone and
Yeah.
some Ramdev Baba eye drops.
Yeah.
Rather than putting all these things, don't put anything in your eyes.
Yeah.
Okay, eyes are self-cleaning. They can take care of themselves. That little bit of dryness will recover once you go to sleep.
Yeah.
If you really want to put, you can use some artificial tears. Like I said, lot of screen time, so a lot of dryness because of that. So that also gets covered if you take frequent breaks from your screen. But artificial tears, max to max. Nothing else should be put in the eyes without the prescription of an ophthalmologist. Don't go to the pharmacy and just buy drops. I've had patients who have been putting steroids for years and then they come with cataract and glaucoma and nothing can be done after you've had advanced glaucoma. I can't bring back your sight.
Yeah.
So don't do that.
How often should somebody get their eyes checked?
Once a year.
Once a year.
Even if you have no eye problems, once a year.
Okay. Where do you see ophthalmology going in the next decade? Is there any role of AI? I recently saw a reel where somebody was talking about a new AI directed LASIK sort of procedure where they are calculating.
Yeah, but I feel like that is just regular LASIK. Okay, you need real intelligence to calculate
Human intelligence.
how much you should knock off, how much you should keep, who you should operate on.
Yeah.
So I don't know if AI has reached that, but I know that AI is used to read some, retinal scans and retinal images where small, like very small microscopic things may be missed. Just leaps and bounds, further and further. Even now, LASIK didn't exist at such a large scale a few years ago. Now everybody knows about LASIK and, SMILE, and there are so many different refractive options available now, including ICL and whatnot. So I think I'm very excited. I think we can just go up from here. Maybe we may not require intraocular lenses in a few years. They are coming up with like some gel sort of injection
just inject
thingy.
and leave it.
Yeah.
But the ophthalmologist is never going to be obsolete.
Oh, I hope not.
I don't think so.
Even for things like retinitis pigmentosa, which was, we can't do anything for you. You are going to go blind. That also is, they're coming up with some sort of artificial bionic eyes and whatnot. So I think
it's exciting.
Future is very exciting.
Thank you so much, Nikhila, for doing this podcast. This is Beyond the Scrubs, and I hope you all enjoyed it. If you have any questions, please do post it in the comments. I will be tagging her Insta account, which is Dr. I Know, and you can directly put your questions to her. Thank you all so much for watching.
Thank you.